Hello everyone, this is Dr. Jaydeep Shinde. I am consultant diabetologist. Today we have gathered here to know a very important link between COVID-19 and diabetes mellitus. Because of all sorts of social awareness and awareness platforms, we already know what are precautions we need to take to prevent the spread or transmission of this viral infection. But what we don't know is what type of care we need to take in our diabetic patients, right? It's a very biggest misconception in between people that if I'm a diabetic, chances of getting corona infection is very high in me. It's not like that. If all your parameters like your blood sugar, weight, everything is well under control, you don't have to worry because your risk is as good as a patient who is a non-diabetic. In special cases in diabetic patients in whom the blood sugars are not under control, if the person is having any underlying complications like heart problem, kidney problem or paralysis, or those who are having any lung issues like bronchial asthma or interstitial lung disease or tuberculosis or any sort of lung condition, in these category of patients, if they get infected with COVID, like corona infections, their outcome is very poor, right? They usually undergo very extensive cytokine storm and they go into respiratory failure. The outcome is really poor. So what you need to take care is you need to understand that if your blood sugars and all other parameters are not under control, get in touch with your diabetologist or your consulting physician and get everything under control either by physical consultation or online consultation, whichever is possible, but get it done. Another thing is people have a very wrong misconception that you're supposed to take hydroxychloroquine to prevent corona infections. Never ever do this, because hydroxychloroquine has got its own share of side effects. If taken in wrong dose and wrong indication, it can show severe complications. So what I would recommend is ask your treating doctor whether you can take it. He will decide according to the medical guidance you are supposed to take it, because it is not for prevention of COVID infections. It is for the treatment for this in a right and particular dose as per ICMR guidelines, and also it can be taken by certain healthcare professionals who are at risk, but that again the dose is to be taken as decided by ICMR. Never take it on your own, right? So you need to keep these things in mind, that you have to keep everything under control, stay hygienic, stay healthy, stay safe, and take care. Thank you so much.